This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Are you a pregnant mama in your 30s? If you are, this Pregnancy Pukeology Podcast, episode 56, all about genetic testing, is perfect for you. And as we're talking about what does genetic testing show and how to have a healthy pregnancy over the age of 35. So stay tuned. Do you want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now, and get 25% off with this special code, PUKE25, PUKE25, or just place No More Nausea Ban on your baby registry for your delivery room bag at Bye Bye Baby, or get it shipped for free on Amazon as a Prime vendor. And just know your little ones are always taken care of with the first No More Nausea Kids and No More Sleepless Nights Kids, which works on mamas with small wrists too, now available at your local CVS stores. So go grab one. Do you want to hear some pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time anyway, with hilarious stories like facial flush, barista serving up the barf, and tell all on the table. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, we'll learn the science behind 5 different genetic testings available, both from screening and diagnostic types of testing, what they show, and ways to keep up your fertility for a healthy pregnancy in moms over 30.
The science of puke, Pukeology.
Genetic testing while pregnant is basically like getting to know your health and the health of your baby while it's still growing inside of your womb. You should feel reassured when your doctor informs you that your baby has no genetic abnormalities. And in the case of abnormalities that are detected, the doctor will be able to intervene before the condition gets worse. Genetic tests are necessary and needed to make a diagnosis. You will be given blood, different samples, and body tissue in order to be analyzed from your baby and from your own body. The importance of doing genetic testing during pregnancy follows a few certain reasons as to why your doctor may recommend genetic testing, because not all moms will be told, hey, you might want to get this. It is available if you are, but if you're over the age of 34, the risk of having a baby with chromosomal abnormalities, such as trisomy, which is having an extra chromosome, is high if you're over the age of 34. And all this is saying is that Down syndrome is actually an increased form or seen as an increased diagnosis when you're doing genetic testing after the age of 34. And these mommies, I hate to say it because I am in advanced maternal age myself, but that's what we call it. Advanced maternal age stickers, and or you'll hear you'll put stuff on the chart that says over age, not the fact that you are over age, because we are all young at heart. But at the same time, when it comes to fertility and the baby, you are considered a little higher risk. So your child is also at a higher risk for developing a single gene type of defect if conceived with an older partner. So let's talk about some risks that you may encounter. While most healthy women who become pregnant after 35 go on to have these beautiful, healthy babies, there are still some increased risks that you should be aware of. Number 1, infertility. According to the CDC, about 12% of women aged 15 to 44 in the United States have difficulty getting pregnant or carrying a pregnancy to term. Now, after 35, the infertility rate in women rise significantly because you have fewer healthy eggs and your body is less likely to be able to release these healthy eggs. Now, multiple births. Infertility issues arising from advanced age can lead prospective parents to seek infertility treatments. This means help getting pregnant. which can cause the possibility for having multiples, meaning you could have twins, triplets, quadruplets, quintuplets. I don't even know what after 5, sextuplets I do know. But again, this will increase that risk of having multiples, especially because half of all births of multiples are premature. So this can lead you to have more complications when it comes to the baby. So women using fertility medications need to be closely monitored throughout their pregnancy. And an in vitro fertilization specialist and or just a fertility doctor will be able to help you and guide you through if you are advanced maternal age and are interested in getting pregnant. And you may want to have a few babies, right? So chromosomal abnormalities is the third. There is a slight increase in chromosomal abnormalities. We kind of started talking about Down syndrome, in which the pregnant mothers are over the age of 35. Now, the March of Dimes reports that the chance of having a baby with Down syndrome increases from 1 in 1,250 births at age 25 to 1 in only 400 births. So you're 3 times more likely to have a baby with Down syndrome at 35 than you are if you had it at 25. Now, again, if you choose to have screening tests, they may diagnose some of these chromosomal abnormalities in early pregnancy, and we'll get to more of that in a little bit. Now, fertility gradually declines in your 30s, particularly after the age of 35. So each month that you try, or a person that you know that is over 35, a healthy, fertile 30-year-old woman has 20% chance of getting pregnant. Wow, that is definitely significantly decreased. And I will tell you that a lot of people always ask me, so how many eggs does a pregnant woman how many eggs does a woman in their 30s have? So I'm going to give you an example. A woman in their 30s usually has about 100,000 to 150,000 eggs in reserve. By the age of 35, the number is likely around 80,000. So we've literally decreased that number by almost half. And in the late 30s, that number could only be 25,000, 10,000, or fewer. So you really do want to keep an eye on it, especially if you're interested in having children, or if all of a sudden that biological clock started ticking and you're like, wow, I'm running out of time. Go see a fertility specialist. It's always a good thing to have them know who you are, have them feel more comfortable, especially if you're like me, a wonderful working woman. And as a physician, again, sometimes we put our child life planning on the back burner. So abnormal prenatal screening tests, they result in something very different, right? So if you receive an abnormal prenatal screening test result, a genetic test might be necessary to help you detect these genetic conditions. So a prior history of inherited illnesses, so genetic testing can help you or plan on whether to start a family if you have a close relative or partner with an inherited illness. Remember, some people might be a carrier of a genetic disorder. What a carrier is going back, I don't know if you remember in biology class, that Punnett square, right? Where it's that big square and then the small 4 little squares that's inside of each one. Well, what that means is that if you are dominant, you possess that gene. So let's just use big X on both sides, right? So let's say we have big X on both sides, that's a dominant. Now you could be a carrier of it where you have one big X and one little tiny X, and that means that you're just carrying it, you don't possess it. Now, when we talk about making a baby girl, we know that you need 2 X's in order for a baby girl to be made. And then, like I always like to say, when it comes to making a man, why you need an X and a Y. Just kidding. Don't tell my husband. So a Y, what happens is the mother that gives the X will be the one that a lot of maternal inheritance types of genetic disorders, for example, baldness, I'm trying to think of some off the cuff of my head right now, but those ones are maternal inheritance. So if your mom is a carrier, you have a much higher risk. Other genetic disorders are that same exact way, whereas if you're having a male baby, the mom is really giving that X, whereas the dad is giving the Y. So if the mom has it, is dominant for it, the baby boy will definitely have it. Now, if the mom is a carrier for this genetic disorder, it's a 50-50 shot because you have two X's, one big one and one little one, like we talked about. So remember, again, carrier genetic disorders do happen if you are a carrier, and you can find out through getting genetic testing. So genetic defects don't always show clinical signs and symptoms. In this situation, your baby will only show the symptoms if he or she inherits 2 copies of the defective gene, one from each parent. Having a child with a serious birth defect. Now, while a baby with a genetic defect doesn't always mean that you will give birth to a child with a genetic problem, it is important to do a genetic test. Some of the birth defects are not inherited, meaning you will have a baby in your next pregnancy. So again, some of these genetic birth defects are not inherited. Sometimes the chromosomes themselves don't align right, and you have what's called different jumping genes, or some way whenever they were making and forming, it didn't form the correct way. Let me give you an example. We have learned that eye color and hair color is a jumping gene. So just because you have a parent with 2 brown eyes, an example, I have babies with blue eyes because it is a jumping gene, and somewhere along the line, like my father has green eyes. So I have that recessive trait of carrying those light eyes to my babies. And guess what? They have the light blue eyes that came from their daddy's side. So again, it doesn't always mean that if you do not have a tested genetic disorder that it won't be predisposed, and vice versa. So sometimes the cause can be spontaneous error in the cells of your child and not in the cells of you or your partner. So it could just be the way that it has been formed in utero. Now, having a miscarriage, that's another. Chromosomal abnormalities in your fetus can lead to pregnancy loss. Having more than 2 miscarriages might point to a genetic problem. And I know that miscarriages are so difficult, especially for all moms. My family has been rid with them. My grandmother had 6 miscarriages. My stepmother had 4 miscarriages. My mother had 2. And so, we were very blessed to have 2 beautiful babies. But if you're curious about miscarriages, what those scientific facts are, please go check out episode 51. It's all about miscarriages, and it actually identifies by each week what is that percentage of chance, because there is still a chance that you would have a baby that is a stillbirth. Again, in practice, I have unfortunately done anesthesia for quite a few stillbirths, and it still brings me to tears to think about it, that a baby would grow all the way through full term, and then something happens at the end and the baby is no longer viable upon it coming out. So check out Miscarriages 51 episode. You'll really be interested in hearing what I have to say. The last thing, having stillbirth with visible signs of genetic conditions. This is what we talked about, where the baby is actually born dead. Genetic testing is recommended to help identify any genetic problems that may have caused this physical problem to happen. So it's important that you figure out and find out, as mom and dad, why was it? And most of the time, most miscarriages or pregnancy losses happen because of a genetic abnormality, whether that's from you, whether that's from the baby, but it's always a blessing to know what's going on. Now, the types of genetic testing during pregnancy vary. So genetic tests during pregnancy are classified into 2 broad categories or groups: screening tests and diagnostic tests. Your doctor will recommend a screening test to help you determine if you are at risk of having a baby with a genetic illness. Diagnostic tests, on the other hand, can be done if you have an abnormal screening test result to tell you whether or not the fetus has the defect itself. It is important to seek counseling services to help you to decide when and what genetic testing you should do when you're pregnant, or what you feel the most comfortable with. Genetic tests. These are tests that are best done during the first trimester and early second trimester. The result is unreliable when these tests are done beyond 19 weeks of pregnancy. The first trimester combined screening test. You give a blood sample at 10 to 12 weeks gestation. An ultrasound will then be done when you're about 11 to 13 weeks pregnant. The first trimester combined screening helps you find out whether you are at risk of giving birth to a baby with Down syndrome, which is trisomy 21, or trisomy 18. But the test does not diagnose these disorders. If the test shows an abnormal result, you will have to go or undergo a diagnostic test, which is a chorionic villi sampling or amniocentesis, and we'll get to more of that in a little bit. Maternal serum screenings. You will be required to give a blood sample when you're about 15 to 20 weeks pregnant. This test does not only show your risk of having a baby with Down syndrome and trisomy 18, but also neurotubal defects like spinal bifida. Again, you will have a diagnostic test to help you know what genetic illnesses the maternal serum screening test results are abnormal, because the screening is just a screening, right? It just screens it through. In order to tell exactly what it is, we have to go in there and do another form of test. Now, a non-invasive prenatal test. This is done after 10 weeks of pregnancy to screen for potential or possible chromosomal disorders such as Down syndrome. Further testing is done when the NIPT result is abnormal to diagnose Down syndrome. This test is done if you are at high risk of giving birth to a baby with a chromosomal abnormality. Your doctor might recommend this test if you previously gave birth to a child with a chromosomal abnormality, or if you're older than 35 years at the time of your birth. Your doctor will ask you to provide a blood sample. The sample is sent to the lab to find out whether or not the fetal DNA is linked to a chromosomal abnormality. The sex of your baby can also be accurately determined during this process. To be sure, let the doctor know if you don't want to find out the sex of the baby before this test is done. So if you want to wait for that beautiful gender reveal party, then make sure that you let them know so they don't spill the beans or spill the tea. Now, a diagnostic genetic testing during pregnancy, there's two of these kind. Chromosomal villi testing, or sampling, chorionic villi sampling, CVS, and not just the pharmacy that you can find nomonazepams or Nomo Sleepless Nights bands at, is a genetic test done to test for Down syndrome. This test is done when you are in the 10th or 12th week of pregnancy. And you should also be about 35 years or older, or have had a positive family history of chromosomal abnormality. The sample you provide is from the chorionic villus, which is, that villi is the placental tissue. So you're physically going in and grabbing and snapping that. So people always ask, how do they do that? Well, it is a large bore needle. So they go in, boop, they pop it through, they grab a piece of the placenta, and then they pull it out for testing. So this test can also be used to accurately determine the sex of your baby as well. Now, in amniocentesis, this test is done when your pregnancy is about 15 to 20 weeks. Your doctor will request an amniotic fluid sample, which is obtaining by inserting a hollow needle into your abdomen. Now, the amniotic fluid is analyzed to detect any genetic illness your baby could be having. Also, an amniocentesis can help determine the sex of your baby and its lung maturation. Diagnostic tests are invasive. During the test, you may bleed, have cramps, leaking amniotic fluid, go into labor, which is preterm labor, or experience a miscarriage. But again, those diagnostic tests have a very low percentage of that. If it is important to you to know whether or not your child has a genetic abnormality, or if you don't want to know, those are both your choices. I'm just letting you know what the data and science has told about each and every one of these diagnostic tests. Now, to get on something a little less serious, let's hear from all of our pregnancy mamas and find out what kind of hilarious puke stories they got themselves into.
Throwing up on a Tuesday? One puke story.
The worst was barfing in a bathroom of an airport, as the automatic toilet continuously flushes in my face and I peed my pants with the force of heaving. My bag was already checked through, so I had no clean pants for the next 6 hours. All I could do was hike my leg up as high as I could and have it blow on the hand dryer to blow on my pants. Oh, you poor mama. That's, I guess, what you call flying in high in the sky when you're pregnant. With my first, I was still working downtown and taking the bus to work. Turns out the bus made me sick. Well, it still does. One day, I got off 2 stops early because I was going to hurl and ran into a coffee shop. I hurriedly asked them for the key to the bathroom, and the barista snottily told me I would have to wait my turn in line and then buy something. I begged. She resisted. When she finally gave me the key, I ran to the bathroom, but I didn't make it and ended up hurling all over the bathroom door. I bought a mint tea and apologetically tipped $20, which was huge money for me back then. I haven't gone back to that coffee shop ever again. Thanks, Sarah, for that funny puke story. From Seattle, Washington, I must say. Thanks, Sarah. We took my sister and her husband out to lunch to tell them the big news that I was pregnant. I didn't get a chance to make the announcement because I threw up all over the table while everyone was eating lunch. I've never been more embarrassed my entire life, and all I know was that the smell of chicken completely repulsed me. I haven't eaten chicken since. Thanks, Aaron Aaron A. from Eda, Minnesota. Thanks for your puke story. Now, do you have a hilarious pregnancy story that you just can't wait to share? Send it to me, Pukeology, Pukeology @nomonausea.com, NOMONAUSEA.com, or tweet me @Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
Healthy choices for healthy pregnancies in women over 35. I know that sounds like it should be a book title, but let's face it, ladies, our eggs are diminishing every day that we are alive. And to give birth to a beautiful, healthy baby, I think it's really important that we do talk about this. And how do we keep up our fertility? And what are the things that we can do before we get pregnant? So if you're already pregnant, give this advice to your bestie. Make sure that they know. And if you're a career woman like me, make sure that they do understand the risks and complications of attempting to have a family in their 30s and 40s. So as we age, we all face a greater risk of gaining weight, developing hypertension, diabetes, thyroid disease, or other health problems. Man, I'm making aging sound so awesome, right? But that can also make conceiving and pregnancy much more difficult. As we talked about before, a woman in her 30s has around 150,000 eggs. By 35, it drops to 80,000. And in their late 30s, it could be 25,000, 10,000, all of those. But you still can get pregnant. So let me myth bust that right now. If you're in your 30s or 40s, you absolutely can still get pregnant. If you have an egg, he can still fertilize it. Is there a test to see how many eggs you have left? Yes, doctors have tests to be able to measure your egg count. There are 2 good ways of actually measuring the amount of eggs that you have. One is an antral follicle count. It's called an AMH. It's actually an anti-Mulroney hormone test. The level of AMH in the blood, and by the way, the actual scientist who developed it is Mulroney. I can't say it because of the 2 dots over type of the U, but this AMH level of blood can help doctors estimate the total number of follicles inside of the ovaries and therefore a woman's total egg count. So again, we can do that testing. However, there are healthy choices that you can make during or before you get pregnant in order to have the chance of having the healthiest type of pregnancy possible, even if you have an advanced maternal age sticker. Maintain a healthy diet. Eat plenty of fresh fruits and vegetables. So I know everybody talks about it. What is that perfect weight, especially while you're pregnant? Well, guess what? It varies between pregnant woman to pregnant woman. But it is very important that you do know what that weight actually is. And believe it or not, I have done an entire podcast on not just what you should be eating in pregnancy, which is episode 16, but how much weight gain is expected and what part of that is the baby. And if you're curious on all that, head over to episode 12, Pukeology Pregnancy Podcast, and you will learn all about weight gain. And so it is also something very important. I have a lot of friends who are infertility physicians as well, and it's interesting what they always say. So if a woman is obese or morbidly obese, they actually recommend that she loses weight. And think of it like this, okay? So if you have, all of your actual organ systems are covered in fat if you're obese, well, they're not able to function properly. So imagine it's being stifled. And I'm using this example of my AC. They have these coils, and around these coils, they put this like insulation. Well, if the insulation is too big, it doesn't allow it to work properly. That's the reason why they need a thinner amount of insulation for it to work regularly. And I'm only using that example because it just happened last night and I had an AC guy that came in to help to repair it. So that being said, if you are morbidly obese or if you're obese and you would like to have a child, try to lose weight ahead of time. And the best way to do that, obviously count the number of calories in and calories out and exercise regularly. Now, this is the second one, and this is very important. Recent studies have actually shown that women who exercise 30 minutes a day, most days, have a greater chance of being fertile than women who do not, that are of the same age. Interesting. Number 3, take 0.4 milligrams of folic acid. Now, a lot of people always ask me what's the difference between milligrams and micrograms. So again, 0.4 milligrams is going to be 400 micrograms of folic acid per day starting 2 to 3 months before you want to try to conceive. Now, folic acid is amazing to help reduce the amount of neural tubal defects that you can find in babies. So it basically is good for their brain and for their spinal cord and all of the things that they need for their organ systems, for their CNS, which is their central nervous system, to be created. So again, we want to avoid spinal bifida, and that's the reason why taking folic acid and prenatal vitamins are so important. Now, I know prenatal vitamins can try to make you constipated, but again, there are prenatal vitamins that are amazing. And if you're trying to figure out which one is the right one for you and your baby, go listen to episode 3, Why Take Prenatal Vitamins, because it's really important that you understand what is the most important parts and what you should be looking for. Don't just grab any one off the shelf. Remember, this is the health and safety of you and your baby. Now, the third one goes without being said, or fourth one, stay away from drugs and alcohol. Pretty understanding. Don't smoke. That's another one. Again, that's something that they've actually found that other children that are being born of women who smoked or smoked during their pregnancy actually have other asthmatic and other lung immaturities. So it's important that you mamas look out after your babies. I understand if you smoke or if you vape, it's difficult, but slap on that nicotine patch and really try to make a difference and a change for your child. Now, ask your doctor before starting any new medications. I need to do a fertility check, podcast, because everyone's been asking me for it. But again, there are some medications that will decrease your ability to get pregnant, and people don't talk about this, so I'm going to. But it's really important that you talk to your doctor, especially before starting medications. And think about this, ladies, 2 to 3 months ahead of time. Try to use Tylenol instead of ibuprofen or anything that we call an NSAID, a non-steroidal anti-inflammatory. And the reason why is because in order for your egg to stick to your uterine wall, you need to have inflammation. It's an inflammatory process that happens. So if you're taking an NSAID, a non-steroidal anti-inflammatory, guess what you're doing? You're decreasing the risk of that you will be able to maintain and become pregnant and then stay pregnant. I'll talk more about that in the fertility section. So talk to your physician before you're trying to conceive and discuss any problems that you might be facing and any type of family or familiar genetic testing that you are aware of or genetic abnormalities, and find out whether or not you will be able to tell if that's something in utero or, again, something that you can have as a newborn genetic testing when they come out. By committing to a healthy lifestyle and ensuring the healthiest possible pregnancy and birth for you and your baby, That's what this pregnancy is all about. And if you're thinking about starting a family and you're older than 35, request an appointment with your OBGYN and talk about the unique challenges that you might be facing for the road ahead. Create a pregnancy plan that's right for you. Now, you know the science behind the 5 different genetic tests available to both screening and diagnostic, what they show, and ways to help keep up your fertility in healthy pregnancies for moms over 35. To give you those answers for the best information about pregnancy that there is to date. If you love Pregnancy Pukeology podcast, let me know with 5-star hearts or 5-star ratings and likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 56. What does genetic testing show while pregnant?
Pukeology Podcast, edutainment at its finest.